Good morning. Today is Wednesday, March 19, 2025. This is a meeting of the County of El Paso Women's Commission. Would you please rise to the pledge of allegiance?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Item number 3 is public comments. We do not have any speakers signed up. We will take no action for item 3. Item 4, regular agenda. 4A, approving minutes from the February 19, 2025.
Good morning, Commissioners. Michelle Cochran with County Administration. If you haven't had an opportunity, here are the minutes from your last meeting on February 19th. I'll just go through slowly, and then we'll ask for a motion to approve.
Motion to approve.
Second.
Commissioner Tiscareno.
Aye.
Commissioner Burt is absent. Commissioner Hall.
Aye.
Commissioner Kelly.
Aye.
Chairwoman Rodriguez is absent. Commissioner Chu.
Aye.
Commissioner Hartwell.
Aye.
Motion carries. Item 4B, discuss the visit to the Project Chance program and jail annex.
Good morning, Commissioners. Michelle Cochran with County Administration. As you know, we coordinated a visit to the jail annex to visit our Project Chance program that the county coordinates through our Criminal Justice Coordination Reentry Division. And I apologize for the last minute changes, but I thank you all for your flexibility. It was a very fruitful visit. We got wonderful feedback from the deputies, the sheriff deputies, I believe. I apologize if I am misstating their titles, but who gave us the tour. We're really pleased with the engagement between Commissioner Buzz and Commissioner Tiscareno and the inmates that were there. They had a really, humble discussion about what they went through. And I'll share more, but I'll open the floor to Dr. Buzz and Commissioner Tiscareno to share their perspective and their experience with that.
Go for it. Go first. You know, it took me a minute to digest everything that we saw, everything that we witnessed, and to hear the ladies speak to us. It was very impressive. And I think that it gave, I don't want to speak for you, but I think it gave me a perspective on the work that we're doing here and how it's going to translate to them coming out of the system and the importance of the work that we're doing here. They had a lot of questions for us, and they were very pointed questions, very intelligent questions, and questions that are actually driven to the goals that we're working on here. So it was very heartwarming to know that we're headed in the right direction with these women. Yeah, I was super impressed. So thank you for coordinating that, because I don't think that I would have ever been able to experience something like that had it not been for this commission and for your efforts. So thank you.
Yes, my pleasure.
Yeah, for myself, it was also very eye-opening. I had no idea what to expect going into it, so I was very ignorant when thinking about how it is in there for the folks in there. But like Dr. Boss said, it was very eye-opening and very humbling, but also very empowering, because like she said, it from the conversations that we had and the when we got to be able to talk with the inmates and everything, they they had a lot to say, and it does show that we're going on the right track, and that we can get there.
What were some of their questions that
I was gonna ask
yeah,
the exact
exactly.
same
What are their
thing.
concerns? Yeah. The main,
And how many were there?
right.
Go ahead.
Yeah, when we visited the Project Chance, it was the class, right? I believe there were about 16, 17
It
ladies
was
there.
about 25. I'm trying to count in my head
Yeah.
the tables right now.
Yeah,
it was
I'm
full.
probably under
24, I think is what they said. 24.
I would say, yeah. Right. But a lot of them were things for like how they can get back on their feet when they get out, or like there's one inmate who was interested in starting up like a food truck when she gets out, and she was asking like about learning like business skills and things like that.
Yeah, there was a couple of questions regarding childcare after imprisonment, and one of the ladies had expressed that she had 4 children under the age of 4. So while she's getting an education in the system, it's all fine and dandy, but if she can't use it on the outside because she can't afford to put her kids in daycare, what resources are there for her to succeed? And so that was one of them. The other, a lot of the questions were wrapped around lack of knowledge of resources once they're out of the system. And so where do they go for housing? Where do they go for medical care? Where do they go for job training and unemployment and to apply for jobs? Those were the majority of the questions I believe and I remember.
That and one that stuck out to me because I was so grateful you were there to answer them. They had a lot of questions around healthcare as well.
They did.
Access to healthcare and how to get that too. But the childcare one, that's one that continues to come up with every demographic.
There was a couple of questions regarding substance use disorder and healthcare once they leave the system, for the fear of falling right back into why they got in the first place and how do they maintain their sobriety. So yeah.
And one thing that struck me, if I may say, is I don't know, just the hope in some of their eyes when they were asking the questions and hearing the responses was just like, I don't know, almost like, okay, like I can get out of this. I can do something different. And it was just super touching.
There was I think everybody in here knows that I have a 12-year-old at home, right? There was one young lady who expressed wanting to go to college after she's released. She's only 18. She's only 18. I thought, oh my gosh, my baby's only 5 years younger than this young lady, but still has aspirations to continue her education.
I went home thinking that evening, just because of some of the questions they were asking, like they're just not even exposed to these things. They don't even know these opportunities or different life that is available because, right, it goes back to the cycle and having access to things or not. They just don't know any different, right? Like the questions they were asking, was like, yes, that's there. Yes, that's there. But what did stand out to me is even the resources that we had there. There was the individual from adult probation giving the class, the reentry individual, and the deputies. And I'm seeing this across different things with veteran resources, with our domestic violence research. It seems that in general, there is a lack of a repository for these resources, right? Like Chief Bessia said, if my officers had something to scan, like a QR code, we'd absolutely give that out, but it just doesn't seem to exist in any avenue that we've seen here in the county. And the Veterans Board is addressing that. That's one of their goals, is to create a resource guide for veteran services. But that's come up with domestic violence, and now seeing the questions from these inmates was what is available to me after we get out. And I think despite sharing with them, there's these entities, Borderplex Alliance, but there's so many more. And And I think maybe they're only being directed to one, or they don't know how to access it, right? These individuals, sure, you give them a QR code to scan, but some may never have used a computer or know what to even do at that point. So I don't know. I just see that as a gap across many areas.
So it sounds like, based on what you all were able to see, that validates the necessity for having this roundtable involving all these organizations. And not only does it validate that, it says we need to do this at all deliberate speed. We need to get this done, because the sooner we can get that coordination going between all these different entities, the sooner that information gets passed along, and we do set up a repository that folks can, all agencies can access. So I think we need to move on that pretty quick.
I agree. I think that after that visit, I can understand why so many inmates end up right back in the prison system, because they come out and they feel lost.
Yeah.
So they don't know where to go. They don't know what to do. They have babies, so they go back to their safe place, and their safe place is the prison system. But if we were able to give them those resources, like you just explained, maybe that might open an avenue for them to choose a different path.
Or the agencies that help them say, look, we got this over here too, or let's call this agency, or let's do this, or somehow coordinate all those different agencies so they can utilize each other.
Yes.
Because we're not doing that. It's obvious that we're not doing that.
Commissioner Harker has her hand up.
Hey everyone. So regarding this topic, the wheels are turning in my head. I'm wondering if there's already like a community resource directory, so we don't reinvent the wheel, for one, and that when inmates leave, maybe there's a person in the county that they can, or an office that they can go to, that it's maybe make it a requirement somehow. I'm not sure if that's possible. They can go to and get that guide, get that information, so they can be the ones to make those phone calls. So at least they have some information or resources available. And that's part of their transition out. And I'm thinking of this based on like what the military does for those service members exiting the military. They have to go through certain classes and get certain information. It's not enough for them, but maybe on this side with the inmates, maybe that's something that might be a recommendation the next time we brief the commissioners.
I think the only community resources that we have in one place right now is 211, and even that is disjointed, because it still puts a lot of responsibility on the person who's actually making the 211 call. I don't think that in all of the resources are in that 211 system either, right? So,
and sometimes I know they had, and that was just my experience, that they had sourced that out too.
Yeah.
So they didn't know about the local. Some of them, unless they were trained, didn't know about the local resources. But Melissa, I was thinking about what you're saying, and I had belonged to a court years ago. Maybe you know, Judge, it was with Judge Anchondo, and it was a prostitution court. And what we did, it was a temporary thing, and what the center did was that we were also included in the people that came back. And they were on probation, but there was the probation, there was the judge, there was myself. And so whatever that person came back and needed, whether it was simple things like, and they didn't know how to access an ID. Some of them had lost their ID years ago and then never, so that just, of course it goes into round and round because they can't get a job, they don't have an ID, and then housing and all that kind of stuff. But we were able to take people, but we would meet with them monthly. And when we talk about probation, maybe that's something that we could have probation when they meet with them, other than just saying, hey, are you staying out of trouble? And I'm not dogging, probation, but their goal is to just make sure that but maybe have a little table for them to say, hey, these are 3 different people at the table. How can we help you? And we would literally walk them over to some of them didn't even know how to access a new driver's license. They didn't have transportation. Now you had to make an appointment, for DPS and all those things against barriers. So they was doing that. So, and we were able to, there was one individual that had 2 children. She got them back after years of not having them and being drug dependent and just going to, but she got a house, was able to get a job. And anyway, but we did work with Workforce Solutions was there to get her a job. But she'd have to check in every month. But she'd have to check in with each entity that she was asking for help.
Yeah.
So I'm just saying maybe with the probation, because all these people are going to have to go out, right, into probation or not.
I don't know if that is the case for every single one, but a couple of things.
Mm-hmm.
So they have the reentry program, who those caseworkers do help them re-enter society. They also can get services from the public defender's office, social workers for up to 6 months after their case is over. And then their main contact is adult probation. But of course, the services that they get are largely dependent upon the assigned officer.
Mm-hmm.
And from what I understand, both reentry with criminal justice coordination and adult probation, their caseloads are like 350 people per officer.
Right.
I think that's the last number I heard. As far as that goes, Chris, public defense, probably a lot of cases, a lot of clients per person.
I worked at the public defender's office for nearly 10 years. It depends on what court you're assigned to. I had caseloads as low as 12 when I was in complex litigation, as high as 200 when I was in misdemeanors. I do think it would be interesting for the commissioners to hear from the public defender's office and their social workers. They do a wonderful job of compiling these resources, but there a lot of times is access issues with getting these to the clients. Clients having consistent cell phone and internet service so that they can be emailed to them. That might be a good group to reach out to. And I know adult probation, especially with the management there, they are wonderful people that try and help out and are really there to do the right thing. But I think it can be very overwhelming for the individual officers. So trying to bridge some of those gaps, those might be some very good groups to hear from and get their input.
That's interesting.
Well, I think again, it means that we need a roundtable.
Right.
Because it's over here and look over there, and maybe we can come here and let's try over there. Yeah. It's we need some help over here. How can we get it? So I think that's the importance. And even setting up a roundtable is going to be really a lot of work and a lot of brainstorming. And then trying to put it together, that's going to be a project in and of itself.
Yeah.
But I think all of this sort of really illustrates in a very profound way how scattered everything is and how everybody needs help. Everybody needs some assistance. So that roundtable stuff is really, I think, get it going. That'll be it.
Is there any, aside from the roundtable, which is an item on your agenda this morning to discuss, we weren't able to hold that meeting? Anything particularly on this that you would like me to bring back to you all?
Is there anybody else that wants to see Project Chance again? I mean, not
another visit.
Another
Yes.
visit for those who didn't get to go.
Thank you, Judge.
But you still go.
No, I've actually went before. Before.
How about who else? Did Commissioner Bird go, or did Commissioner?
No, she sat out because she said since her schedule's a little bit more flexible, she bowed out to allow those who are working, who had their schedule set.
So I would like
So
to
that's-
go, but
Okay.
maybe she and I can go, or maybe I can go with Commissioner Rodriguez.
Okay.
I think
Another
there's,
second visit.
If there's going to be a second visit, I'll go. I mean, as long as we don't.
Well, if that's the case, we'll have to do 2 more visits.
No, that's okay. No, that's okay. No, because I just wanted to make sure that everybody gets a chance to go. Yeah.
Just because if we did Judge Chu, Bird, and Commissioner.
Then it'd be a quorum after.
We'd have-
Yeah. Okay.
And you, we'd have.
Yeah. Okay. No. Never mind. No. It's good.
Commissioner
There are
Hartco,
2 visits.
did you want to visit?
It's a little difficult with work at times. I'll work on a weekend and I'll get some flex time, but that just really varies. So I don't want to make any promises right now. But I would love to. I just can't confirm.
Okay, well, I'll start with Judge Chu. I'll ask Commissioner Bird and Commissioner Rodriguez if they would like to go. I'll schedule that, and then if there's space, I'll reach out to you, Commissioner Harco or Commissioner Chavira. And then if there's a need for a third visit, I know they would be more than willing to coordinate another one. So we'll go from there.
Yes, that'd be great.
And then would you all like me to schedule the criminal justice coordination again, the reentry, public defender, or adult probation to ask more questions, or do we simply identify them as a stakeholder for the summit?
I think that, I mean, unless we need to know more information about what they do, we know sort of what they do. To me, it's more important. I mean, what we're gonna learn in the end is, oh, we need to have the roundtable. You know, I mean, I
They
think
need to
that's
be included.
ultimately what we're gonna come. Oh, yeah, that's great. What you're doing is wonderful. That's good. But we need to connect you to the other.
Yeah, because what I'm hearing is the officers need assistance,
Yeah,
right? So
yeah.
they need to be able to have those resources. Yeah, I agree with you, Judge.
So
Okay, very good. So if nothing else on this item, we'll move to the next item.
yes.
Okay.
No action for 4B.
Thank you, no action. Item 4C, discuss the planning of a potential summit to include topics, stakeholders, and county resources.
Good morning, Commissioners. Michelle Cochran with County Administration. Chairwoman Rodriguez asked me to add this to the regular agenda for this month since we've not been able to have the special meeting scheduled for this, which is fine. You all are working. There's lots to coordinate. We're doing the visits. It's a lot of demand right now. But we wanted to take advantage of having you all here meeting today to discuss this. So I don't know if there have been any conversations behind the scenes on this, but this would be the time for us to discuss maybe goal timeframes, stakeholders, what topics we're even going to cover to try to narrow this down and get this going.
Well, do we need a date first?
I think a date is a good place to start, date and venue, which could depend on how many people we intend on inviting. But maybe, and I imagine this would have to be in a county building if we consider.
So we're gonna have to do, there's a quorum of the commission, then yes, it's gonna be a public meeting subject to TOMA. Also, because we're using county resources, we do need to do a public purpose analysis. So we're gonna need a little bit of a heads up.
I would think.
Yeah.
I would think you need several months of a heads up. I mean,
Very likely.
number one, people's schedules. Number two, venue. So maybe we start with looking at sort of a date or two dates, and then move to a venue, and then move to the sort of the structure of how it looks,
Right.
how it looks, and then do invitations. It's going to be tricky, you know, with that many people. So maybe let's start with a date, because it's going to be, I would say, 4 to 6 months out, if not more.
And location-wise, what did you all have in mind? You want? I don't think you would like the commissioner's court setup where you're on the dais talking to the audience, more of a round tables or conference style. Any thoughts or ideas on that? I'm just trying to think what venues we would have here at the county.
Definitely a conference style.
I agree with that too. I don't think you need to.
I don't think there's any really rooms that offer a conference style that would be large enough.
The only one I can think of is juvenile probation. That's where the Commissioners Court has their strategic planning session. And the way they're setting it up this year, we're about to have that in a couple of weeks. And the way they're setting it up this year is pretty neat. It's like this is in the center, a table like this is in the center, and then a few tables out. So you could have identified seats for maybe a representative or two from the commission, stakeholders, and then we'd have several additional seats for more people to sit behind so that it's generally a round table. Or
should we identify how many invites we would be having so that we can venue from there?
It would have to be at least what, 20?
Oh, I think more.
30?
I think more, yeah, like 30
30?
plus.
yeah, I think depending on who the stakeholders are, you'll have individuals, for example, let's say PD is going to be one. I imagine PD, sheriffs, they'll bring a handful of people.
Mm-hmm. And maybe in this invite, and I don't know what you all think about limiting it to, not that we don't want a lot, but we do want the main players.
That's right, decision makers.
Yeah, and not send 5, and I know that, you know, that aren't going to
That's right.
be able to implement. We want them to hear and see and work with the others at the very top so that we don't have that, you know, having to explain again or, you know, redo those things, especially now with all the new leaders that we have.
So some of the ones you've already identified, which correct me if I'm wrong, but Ms. Catherine Jones from the Criminal Justice Coordination Division was the one who suggested this, and I think would be important to have.
Sure.
Yes, okay.
Yeah.
Sheriff,
Mm-hmm.
PD.
I think because it's countywide, we need to include the other smaller entities like Horizon PD, Socorro PD, because that's where we have a lot of people.
Agents, yeah.
San Eli has marshals there.
San Eli has their own police department.
Mm-hmm. We have 2 marshals.
Probation, right?
Adult probation.
The DA.
Yeah,
Attorney, probably
Judge
Judge Vasquez.
Mm-hmm.
I think we also have to include all of those other people that offer the services.
Mm-hmm.
Public defender.
Right.
Right. Public Defender's Office, definitely.
Yeah, public defender for sure.
Casby.
but I think those people
Casby.
like
Casby.
Casby, all
Mhm.
the every entity that we know offers a service, they ought to be there. Say, oh yeah, we can do that.
The jail reentry also.
Is that with the same person as the criminal justice?
Yeah.
Yes, okay.
And then Centro San Vicente's behavioral health team.
Yeah, there you go. Although some others that we've heard from.
We have not heard from Emergence, but when we went to the jail, they said that Emergence is
Oh, yeah.
provided in the
Yeah.
jail.
Okay.
Definitely emergence. How about UMC?
We're actually going to meet with, we can come back to that. UMC is going to be here for item B because you all asked for March to gather information on access to healthcare. And I reached out to them and Fix, and without additional conversation or questions, it was really hard to narrow down any sort of data point that they may be able to gather. It's not readily available. So they're going to be here indeed to talk about that. So based on that conversation, I mean, I think they could be included. I don't the direction.
How about somebody, any resources, Commissioner Harkle, for veterans?
Can you repeat that?
Any resources or people that we should contact to attend this that related to the veterans community?
I'm thinking the military veteran peer network, because I know they visit often with veterans in the jails, and I'm not sure if some of those peer coordinators are mentors at the Veterans Treatment Court. But definitely the Veterans Treatment Court. I think they have 2 judges, and they have an administrator, Yvonne Whitaker. No, what's her name? Yeah. So the Military Veteran Peer Network and the Veterans Treatment Court, for sure.
What if we included Fix as well? Fix and Emily Hartman. They're the health integration
Oh,
exchange.
yeah, that we heard from, right? Yeah, I think we
Yeah.
ought to, absolutely. Yeah, yeah.
What do you think of the Veterans Transition Living Center? They're a part of the Opportunity Center.
Why not?
Yeah.
Yeah. Okay.
And
So that would be.
how-
Sorry, I was just gonna say that would be John Martin.
yes.
What was the name?
John Martin.
John Martin. He runs the.
Opportunity Center.
Yes, the V.
Yeah, he's the deputy director.
Yes.
How about are there
The
any agencies that do
YWCA?
substance abuse? Are there some?
Yeah, somebody said that does it for the justice.
And then the military CID.
Military.
CID, they're police investigations. Because a lot of the people live off base. We get a lot of military.
I would also suggest the El Paso VA. They do also work with wraparound services for veterans. I'm not sure if it would be the homeless program that's involved with the justice involved vets. And maybe even the Texas Veterans Commission, but that would be like higher up leadership. But if we're planning this month out, maybe they can make the time to, or the availability to come, because the mental health department is part of. They're the ones who train the Military Veteran Peer Network coordinators, and they're the ones who give funding to the Veterans Treatment Court. So it might be good to include them as well.
What about the Transitional Living Center? I don't know, I'm just throwing out names there for that.
Women's shelter?
Yeah, Cassidy, that's part of Cassidy. Yeah.
Is that part of Cass?
Yes.
Why?
Well, there's other ones too. I mean, there's other entities. Can't remember her name. It runs a shelter on in the valley. The other one. I don't know why her name escapes me. I'll think of it right now. The Reynolds Home. That's an all women's shelter.
Maybe also
Oh yeah.
often have community, that are in situations where they're dealing with issues like that, and at least have those resources to guide them where they need to go, or have better handling for them.
Miss Dodd and Project Bravo as well.
There you go. How about also along that line, Diocese Las Americas,
Yes.
Borderland Network? I don't know if that's more civil rights. I don't know if that's, and maybe even El Paso Legal Aid, El Paso World Legal Aid.
Yeah.
Did we get the workforce in there?
Workforce. Yeah.
The what?
Workforce. And how about CPS?
I mean, why would it hurt?
Yeah, I'm just saying some of these people might have
They
been
also have lots of,
right.
of course, they can't offer any services unless you're a part of the
The system. Yeah.
El Paso Fighting Hunger.
Yes.
Or Kelly Patrick, whichever.
The reason I think of CPS is because some of them are in that system because they didn't have childcare and left them with somebody else or left them alone, and then they got into trouble for it because somebody hurt them while they're under that care. I mean, I've known women that went to work because they need to work, but then they leave them with somebody they really don't know, and then now the child gets hurt, and now they're in trouble for leaving them. So it's a back and forth.
I mean, I don't think it helps, it hurts to have them included in the conversation. Although they won't
can't.
offer services to anybody who's not in their system.
Okay,
Yeah, I don't think. I mean, they don't.
right,
Yeah, I'm sure they
right.
don't.
No, they don't.
But some of those people who are in their system ought to be, maybe the ones we're talking about too.
Right, right.
That's what you're getting to, yeah.
Yes. Like the ones that are incarcerated, where are those children? If they're incarcerated, she's already in their system. Because those children needed to.
Unless they're with a family, yeah.
But I mean, either way they get involved. CPS has to get involved to place them with family, so.
The other parent is available.
Right. Mhm.
So I added the ones you said. Last ones are all past ones: Fighting Hunger and the Kelly Food Bank, which is the local pantry. That puts us at 30 stakeholders at the moment.
See, and we're just sitting
Right.
Yeah.
And we can open it to more people should the venue allow, but 30 people at the table is a lot already. May I recommend we go ahead and talk about what topics you want to discuss, and perhaps that may narrow down any stakeholders at the table. Of course, these other people can be invited.
That's how that we would pitch it to them. First and have invite one would hope that.
Great question. I think narrowing down the topics would help us draft that
Let's look at what our
invitation.
objective is.
Exactly.
What is our objective? What do we want to get out of this meeting? And there's going to be a lot of them because this first meeting is just a exploratory brainstorming, setting the foundation, and then again to sort of come up with it. Because what we really want to do, and let me see if I'm just sort of standing here now, is what we want from this summit: the ability to have a resource directory that is available to every single kind of agency that provides.
I think maybe we need to focus on core necessities, health, housing, food, those things that we need to
Childcare.
on that day.
Yeah.
Yeah, and continue identifying barriers and gaps in services.
Right. How about something to the effect is when they come, all those people that come, we have them answer our questions as, do you offer healthcare for women? Do you offer childcare? Do you offer this? So that we can narrow it down and make, what services do you offer for women, right? And so that,
We could create a survey prior to.
and so all those main topics that we want, we'd know who offers what and still bring them in, but at least know what do they offer.
That's going to be a minute for you to get responses, though, no?
Oh, yeah, I guess. We want it now. No,
I know.
Well, or we can do it at the first meeting. What do you, and right then there, you know how we had our little board, not necessarily have that board, but say, okay, now all these agencies offer healthcare. All these agencies offer childcare. All these agencies offer this. So then the lists already are compiled as we go, I guess.
Are you suggesting that we invite all of them and versus just a few to create a core and then go from there?
I would say invite all of them first so we can have an idea of what they all service, what kind of services they offer. Some might be offering, well, I don't know what everybody, but some might have a little niche or offer a service that we don't know about, that helps those situations.
So I'm going to go back to, is our objective to set up is that what we want to have? Is a central directory of services?
Yes.
Yeah.
Or do we want that just to be a byproduct of this? And because when this came up in January, the conversation began as these entities are not speaking to each other. Everybody's working in silos. They're not talking, and one place thinks another place is doing something, and they're not.
I think having it as a byproduct beneficial because that first initiative of getting everyone in one room together and everyone else seeing like what other programs are there or what programs are missing or maybe realizing some programs don't even exist anymore. That way, it gets that conversation going.
I understand.
And then,
So we can have two objectives. We can have
Right.
one to, how to phrase this, you all who are in this business need to help me. What I want to say is the initiation of a conversation between different entities, sort of like what the Fix program does, it sort of brings everybody together. What's that called? There has to be a phrase for something like that.
I should.
Let's ask
That's sort of-
ChatGPT. 1 second.
And that the goal is for them to use each other,
That's
to
right,
meet with
that's
each
right,
other and
that's right.
use each other in those instances, have direct contact. Once you need that resource, you have direct contact and you pass. We used to call it a warm handshake.
Warm handoff.
A warm handoff, right? That you hand them off specifically so they're not lost in the system. They go from this person, and if that doesn't work, then they go back, and then
Yeah.
find out what they need. But we try to do the warm handoff to each entity. We introduce them to the detectives, tell them this is the person that can help you. If they can't help you, we come back to us.
Got it.
ChatGPT says a word for bringing people together is unite or unification. Other terms could include reconcile, converge, or bond. Each can be used depending on the context, but they all convey the idea of bringing individuals or groups together for a common purpose or cause.
What's it called? Say that again. A convergent.
Unite, unification, reconcile, converge, or bond. I feel like unification has a nice.
like unification.
Mm-hmm. So for unification
I mean, we're all going.
of services,
Yeah.
which still needs to be
Yeah.
wordsmith a little bit, but get the general idea right.
Services for
From there, we would hope that,
Create a network.
it's just what it is. It's a summit. It's a summit of people who are with offering services. Okay. Then, so our goal is that a unification of services, programs. And from that, we'll have the objective of a directory of services.
Sorry.
Easy, we just get that, easy, but we do those two.
I like that.
Summit of services. Okay, so now we sort of know what we want to achieve out of this. First one, this unification of services, and hopefully move to a directory. How we do that, how it's structured for the actual meeting is yet to be determined. But there's going to have to be some structure and some agenda that will allow us to do that in a meeting. Because we're not going to have them for a while unless we did a whole half day. That may be the result. How do we achieve this? Maybe there's a half day summit where everybody comes together and says, these are our ideas, and we brainstorm and then put it all together. That's sort of the details of the right form.
They could, and what we were talking about before is like the directory of services with coordination of the use of each service. That makes sense. Like the coordination of the use of each service to each, I don't know how to describe it. But we're trying to coordinate the using of these services. We're going to identify them all and have the directory, and then we need to coordinate how are we going to use all these with each other.
we could do some preparatory work prior to it. So we could send a survey to these individuals that would gather answers to some of these questions, categorize them. And then I don't know how big we want to go with this with the first thing, but in my head, I'm seeing a lobby of tables set up with everybody's services so they can educate. And then from that survey, we could identify either what the gaps are or who we want to speak on it and have a few keynotes of individuals speak on that to close those gaps, but that would include a lot of preparatory work to put that on. Or those could be broken up into two different things, or if that's not what you have in mind at all.
I'm just, you know what, how about this? And I'm, again, throwing it out, I'm not attached to it. You know how they do health fairs?
Right.
And so that you're setting up tables, so each one of these, we're invited to set up a health, like a table, that put up their services, and have that for the first 30 minutes or so, 45 of the people that you have invited, and then move into this may be ridiculously too complicated, but then move into the actual summit, to the actual meeting, and then begin the meeting with all those people who are just, now we've seen what they all do in a way that is informal, and not people just talking one after the other, but rather going to each of those tables. So that entity would then have a decision maker at the meeting, and employees or staff dealing with other decision makers from other different entities. And then those decision makers and staff go into this meeting and say, okay, now we've sort of seen all the different programs. What do we do?
How do we work? Yeah,
How do we
work together?
And we could have this survey prior to, and when as people arrive, pass out like these are the gaps that people are saying exist.
Have someone introduce it, and
then they could go talk to each
a
other about
background. And I would suggest that we, again, we'll get into details of how this is, but have a whiteboard of somebody taking notes so that we can capture those notes, suggestions.
So I believe probate does something similar to that. And it's actually next week where they have all the tables set out in the lobby here. And then they all go into the commissioner's courtroom for a presentation meeting. We could, similar concept, health fair out there in the lobby. And then here in the commissioner's court lobby, we could set up a table like this and additional space just because it's not a huge room, depending on how many people you want. We could use the lobby right there to have a meeting. Done that for other things as well.
That's a good idea. I like Judge's idea because it allows individuals to network informally, identify gaps, but at the same time, know what each other is doing so that we try to eliminate working in silos.
Right.
Planting the seeds.
Ooh, I kind of like that as the thing.
Yes.
Eliminate working in silos, a unification summit.
Yeah.
And the end, I mean, maybe at that meeting time, the end goal is to actively coordinate, like whether it's with training, like teach that entity, go back and say, hey, we're going to have a class for all the officers on what the behavioral center does. I mean, and if you come across this person, this is what you're going to do, so that they keep passing it on and passing it on. So that it's not just that one person knowing that they implement something out of all this. They implement something in their own program, their own department that definitely does that hand up, you know what I mean? And coordinates with other people. Yeah. I'm thinking way in the future.
I think we got a pretty good outline, right? Let's look at dates.
What do you got going in 2027, Jen?
So is there anything else you wanted to know?
Can we actually, because I didn't hear too good, restate the objectives?
I have the goal is to bring people together in a summit format for unification of services and help eliminate silo theory of services And then as an objective, as a byproduct of that, a directory of services with maybe even contact information to be published or whatever, so that all of these different entities have access to that directory.
Okay, and then we were
And it will be
talking about, oh, go ahead.
That will be an evolving kind of thing, because there'll be more, there may be different services, that new ones that come in, or maybe they change a name or something. So that's sort of an evolving.
Okay, and we're
and
talking
directory.
about one of those ways is having like a fair, like a resource fair.
That's
sort of.
right. And then bringing everybody in to meet to say, okay, now we've had an opportunity to see what each of us do. How do we make it work? How do we open the door to that silo and go into the next silo?
Mhm. Okay, so
Or use
creating
it,
a
or
list.
build bridges to each of the silos.
So closing gaps in networking, and then creating a resource directory
Mhm.
that hits on our goals, which is also closing in those gaps in services for
Right.
women, the various services as well. Okay.
This is very aspirational, so it's
I
going
know,
to
it
take some
is.
time to plan, because the one thing I think is important is that if we're going to do it, it better be done really well, because otherwise
It has to be super
the
organized.
potential for having egg on our face increases the less we prepare. So I say we do it at least, give ourselves, based on your experiences, are there months that are better for these kinds of projects or meetings? Like a September, people go on summer vacation during the summer, or you don't want to necessarily do it during spring break, or I don't know, are there considerations like that for setting up these kinds of
Or for getting
programs?
the best traffic.
Mhm. Right. Any idea?
I don't have a ton of experience specifically in this arena, but I could perhaps ask maybe Catherine Jones if she's aware of any best timeframes for it.
I'm thinking,
But I guess too, how quickly do you want some of this to come to fruition? Because I know one of the things that came up in your roundtable last month was training and education in schools. And so if that is something that you want to come on this, then prior to the next school year starting, to give them time to implement that, maybe a consideration. Or that could be a goal for next year after this, because maybe summer wouldn't be a great time to gather these.
Yeah, that's what I was thinking too. Like, as far as events are concerned, like, we want to give everybody time to coordinate this, right? Because it's going to be a couple of months. Summer's not a good deal because everybody's out of town. August, baby starts school, so everybody's running frantic. And you don't want to do anything mid-October and beyond because of the holidays. So what if we think about September, early October? Like after, was it Labor Day, Memorial Day, whatever holiday?
Labor Day is the 1st of September.
Labor Day?
and is there a day that's better? Monday, Tuesday, maybe.
Tuesday. I think usually Tuesday through Thursdays are better for if we're going to have commissioner support. We also have the Sheriff's Office Academy that may be an option as well. It's a county facility.
Oh, yeah.
Way, of course, out at the jail annex, but it is a bigger space. But that's an option as well. But here at the courthouse, I would say Tuesday through Thursday because, of course, Mondays commissioner support and Fridays typically are reserved for large jury days. They usually have reserved for that. Budget should be done by then, so we shouldn't have any meetings the first or second week of December for budget purposes. which would be my only other concern for September. Here, anyway.
If we're doing it here, yeah.
But Labor Day falls on the 1st this year.
That's Monday.
Okay.
What about the 4th?
Can we get it done in that time?
Okay. That's 6 months. Oh, almost 6 months from today.
Yeah, I think the 4th or the 18th. We don't want to do it on 9/11.
Oh, yeah, that's right.
The only thing with the 18th is the Commissioners Court special session.
Okay. How about 9/25/25? I'm starting to think of dates that would be easy to remember.
That's a good day too.
That's a good way,
it is.
That works.
That work? I mean,
Yeah.
let me check my calendar.
Check your calendars, please. And location. First choice is here.
Yeah.
Courthouse. And you like the idea of the lobby and commissioners lobby?
Commissioners lobby and
The third floor lobby for the table setup, the informal networking and commissioners court lobby. Would you all want to provide breakfast or snacks?
I think we need to. Everybody needs coffee and something.
I mean, yeah. I agree.
Once we formalize a little further, we would need to go to commissioner's court to ask for
Yeah.
funding for that using the
How-
county resources.
Do we need to ask permission?
So I know we're gonna need to do a public purpose analysis. The actual purchasing questions I can't answer right now, but I can get back to you.
Typically, it goes with your all's public purpose analysis.
But do we need to go to them and say, may we do this, put on the summit?
You would need to get permission from the court to utilize county resources to do so. But would want the county attorney's public purpose analysis prior to
Okay.
going to the court with that. Because they would more than likely
So,
need that or want that information.
so I think that should be done first thing then, sooner rather than later, so that, I mean, we're gonna need a lot of time just to get this really set up, so.
No, I haven't read.
Chris, can you start working on that then? Or do we need to vote on it, or do we?
We don't need to vote now, but I do need to talk with Michelle afterwards. So we
Okay.
get a little more details. And
Okay.
We can start working on it.
Okay,
And I'll submit the request for the opinion.
okay,
And I assume it will be assigned to this. We'll talk on that.
okay,
But the direction is sufficient for today.
okay.
No action for item 4C. Item 4D, discuss and take appropriate action regarding the Women's Commission short and long-term tasks and goals.
Good morning, Commissioners. Michelle Cochran with the County Administration. So for March, you all asked to start gathering data specifically on access to healthcare for unemployed women and migrants. I reached out to both UMC and FIX for this, and it's a very broad question. And so neither entity, without additional questions or information, was able to give us anything. John Law, who's the strategic director for for UMC will be joining us around 11 virtually to just discuss what access to healthcare even means and what that looks like and just the definition of that to help narrow the data points that you all are interested in so that they can see whether or not they already have that information or not. They did share with me, UMC, of course, is our county hospital, so they didn't gather status information until it was required by law recently. And so they may not have that data that you all are seeking. Fix had some follow-up questions on that. They said that they don't have anything existing on healthcare stats for unemployed women, but they could work with us to look at employment status and health outcomes for women, but would require some work to use natural language processing to tag free text notes on occupation/employment status. It is possible, it just does not exist at the moment. Regarding migrants, they had some questions. Are you looking for information on migrants in general or any individuals who identify as being undocumented? They ask because some of the data that they could use are specific to the specific type of group that you all are looking to better understand. So if we could have some discussion on the data exactly that you were seeking to help better guide me and the entities as far as what it is you would like to collect. And then we could just give it, we can have that conversation, and if we're not at 11 and John Amanya hasn't joined us yet, perhaps we could take a short recess just to give him time to get a 10 o'clock meeting then.
Maybe you guys can help me because I can't ever remember what I had for breakfast, but what was our intention of getting information from the migrants?
Commissioner Paz, I was thinking the exact same thing. I remember that.
I did ask Chairman Rodriguez to join us because she was the one, if I recall correctly, who specifically asked for that data point. She texted me that unfortunately she's not going to be able to join us. And I don't have information as to why she had that on there. So, but a few stories have come up, right? Of course, with the new administration, ICE doing raids at schools and things like that. And I know Commissioner Rodriguez specifically shared that story about her family in South Texas that experienced that or received that note from the school district. Recall, she shared they received a note from the school district about them being allowed on the bus, they targeted on the bus.
So I know that UMC is required to ask the question. Everybody comes in, are you, I don't know the specific question, but it's something like, do you have documentation or are you here with legal papers or whatever? They do not have to answer that. The person does not have to answer that. But that's, I don't know that they tell them that when they ask the question.
Don't.
Okay, they just say, are you here legally? And they're good, yeah. They should say, you don't have to answer if you don't want to, but that's.
And maybe we can ask that question. What is the exact question and what do and don't tell them about that question?
It's a fine line.
Oh, okay.
So, I mean, I don't know how to say this piece. We don't want to put our targets on our backs by coaching our individuals to say one thing or another.
Right, right.
That's the bottom line.
Okay. No, I was asking you, when UMC comes on, what do they ask?
That's the problem.
Okay.
So they ask the question, but there's no follow-up to the question.
I get you. Okay.
So there's,
I don't know if they preface it and say, we're required to ask this question. You are not necessarily required to answer it, but here's the question. I wonder, yeah.
It's just, are you
okay.
not? It's a very touchy situation.
Perhaps it was in reference to access to healthcare. I don't know.
I think it was.
pause on that and just discuss.
Why don't we hit pause and have them wait and have them come another time? Can we do that? Can we reach him?
Yes, we could reach John Law another time. But I think it would be great if he still joined us today just to talk about access in general and what
Okay.
that means and what UMS does to address that in our community.
I wonder, my memory is starting to be jogged now. I wonder if it was because there was a fear of individuals not accessing healthcare because of these particular orders that are being placed. And what would that look like, healthcare dynamic throughout the city?
And I don't know that we'll know that till,
Long,
yeah. Because that directive was really initiated by Governor Abbott.
Yeah. Because even at the federal level, we ask for social security numbers. They don't have to provide it. But if they don't provide it, doesn't mean that they're not a non-citizen, right?
Right.
So even our data at the federal level is not going to be accurate.
So is the recommend, should we take a 15-minute break?
Absolutely, yes, if we could to wait for John, but as far as unemployed women, like I mentioned, they don't have anything, healthcare stats for unemployed women specifically. But is there any additional information we could provide to fix as far as what it is we are trying to extract from that they could potentially get there?
I don't know.
Could we shoot a text to Carolyn or Judith?
She can't respond.
She said
Yeah.
she's,
Okay.
I like the idea of having health outcomes for those individuals who are unemployed.
okay.
That could give us a lot of information.
Is that specific enough?
For those women who are employed, correct?
Employed or unemployed?
Unemployed, yeah, specific to women, correct?
And maybe we can even could we do a comparison of health outcomes to those who are unemployed versus employed?
Yes.
Would you guys see that as beneficial?
It'd be interesting. I mean, it'd be interesting to see. Be more interesting if there's a real difference.
Right?
Yeah. Why is that?
She said that is possible, but she just
Okay.
wanted additional information. Yeah. So I will ask Fix for that information. And then, yes, Judge Chu, if we could take a recess till 11. Mr. Law should be joining us.
Okay.
The Women's Commission will recess until 11 a.m.
Just we'll go to item E, and we'll come back to D once our guest joins.
Okay, the Women's Commission has reconvened to regular open session. We'd like to go to item 4B, discuss and take appropriate action regarding setting agenda items for next meeting.
Morning, Commissioners. Michelle Cox, County Administration. This is a standing item you have regarding the agenda items for the next meeting. As you know, our next meeting is April 17th. And I was just wondering what you all would like to put on that. May take some time depending on the next conversation that we have with our guest. But would you like me to include the summit item back in the month? Okay.
16th.
I'm so sorry. I was thinking, I don't know why Thursday for Commissioners, but I thank you so much.
No, that's okay.
16th, right?
Yes.
Yes.
April. We'll put the summit back on for discussion. Anything else?
Do we want to create questions for the survey, or is that something that maybe we can look at questions for maybe asking?
A working session?
Mm-hmm.
Working session? Well, I think that would fall under the summit discussion.
Okay.
If there are no other particular items, we'll keep all of the regular items, including the summit discussion planning for next month.
Excuse me, Michelle? Can you
Yes.
hear me? I have an echo on my end, so I couldn't really get it. Are we on 4E?
We went to 4E just to give Mr. Law a little bit of time to join us. So yes, Commissioner, we are on, sorry, I think the microphone is over here and I'm talking to you behind me. I'm so sorry. And we said that they would like to include the summit discussion planning for next month. Were there any other items that you would like to add, Commissioner?
Yes, I'd like to. I asked for it last time, but it was probably missed. But I'd like to see if we can get another update from that gentleman who briefed us last month about all these executive orders and how it may affect nonprofits and other grants going on.
Aaron Settler?
Mm-hmm.
Yes.
Yes.
Okay, I'll be sure to add that on.
Appreciate it. Thank you.
Yes, of course.
Good
I
idea.
apologize if I missed that.
It's no problem. It's no problem. Thank you.
Thank you. Okay, if there's no others, we'll go back to item D. Mr. Law has joined us. And so we'll just read in the item, John, and then we'll be right with you.
So we take no action for item 4E. Item 4D, discuss and take appropriate action regarding the Women's Commission short and long-term tasks and goals.
Good morning, Commissioner Michelle Cockman, County Administration. As part of your discussion, since your inception, you all have several short and long-term goals that you're still discussing. You have provided direction moving forward, specifically in the arena of criminal justice, domestic violence. But one of the other areas of importance was healthcare and access of healthcare for women in El Paso County. You had asked that we gather information for this month, but as I discussed shortly moments ago, that without additional information, our partners were unable to gather that information, and I just wanted to touch base to see exactly what it was that you wanted gathered for that. So that was the reason for the broad posting language. Mr. John Law with University Medical Center has graciously offered to join us today to educate us on what access looks like, what we should be looking at, just to help you hone in on your goal around this area because it is broad. John?
Well, good morning. Thank you so much for letting me join you. And I'm sorry I can't be there in person. I'm running around a little this morning. So thanks for being flexible with me. I understand. I on some level, I don't know exactly what the commission would like. And I'm very open to helping you get data if that's helpful, or any other insights that would help you formulate the vision you're trying to develop. if I could just offer an initial thought when we talk about access, and then maybe I can just listen and hear what you're looking for. Access is one of those words that I think is it's a very broad word, and it often gets used in a lot of ways, and so I always find that defining it is really critical. And I'll give you sort of a simple definition I have, and then from my own look at it over many years, there's many dimensions to access, and that's part of what I would want to hear from you. So I look at access as being able to get the healthcare you need when you need it. I'll just put it and make it that simple. But what's key from my point of view about access are different dimensions. A lot of times when we talk about access, we talk about affordability. So can you afford the healthcare you need? And that's usually what people dial in on. So if you don't have insurance coverage or you're not independently wealthy, it can be difficult to afford healthcare. And so that's one dimension. A second dimension is the care you need available? So, does it exist in your community, or does it exist in a way that you can get to? So, sometimes available has to do with specialties that are hard to find in our community. Sometimes available has to do with really long wait times. I know in certain areas you can wait 3 and 4 hours, even in the doctor's office. And if you're in a job where it's hard to get away for that amount of time, there's an availability issue for you. And then the third domain I would say that's important is it acceptable? And the acceptable part is probably the most subjective of the 3 domains, because it kind of comes back to culture, and it comes back to different variables. So for example, like if you're a monolingual Spanish speaker and you can't communicate with your provider, to me, that could be an acceptability issue. I think of certain cultures where if a woman can only see a gynecologist that's male, that might be unacceptable. And so then that becomes, it becomes an acceptability issue. And so the way I think about it is well, if you can afford it and it's available, but it's unacceptable, you don't have access. If it's available and it's acceptable, but you can't afford it, you don't have access, and obviously if it's not available at all, it doesn't matter how rich you are, you don't have access. And so all of those domains are important from my point of view. So anyways, that's sort of my big picture view of what access means. And I think I'm really interested to hear what you all would like to learn more about. And I certainly have access, different use of the word, to a lot of data. And if that would be helpful to you, or if there's some other resources I can bring to the commission, I'd be very happy to be helpful.
Mr. Law, thank you for joining us. I think when we first posed this question, well, first of all, I love the way that you have set up these 3 components of access. I think that's very helpful. When we first looked at this question, I think we were looking at it in the context of primarily Governor Abbott's order early on. This is before January 20th, where he has required healthcare facilities, I guess, to ask a question concerning legal documentation, and I think primarily our question was, what is the question exactly? And secondly, are there any conditions or prefaces to the question? I know, actually from my meetings with UMC on the board, that the respondent is not necessarily required to answer that question, but does the respondent know that he or she is not required to respond? So it was in that context, I think, that we first looked at the word, access. So can you help us with that to begin, just to, on that issue?
Yeah. So, and I'm not, and Judge Chu, you obviously have a better legal background than I do, but so from what the governor has required is that we do ask patients about their documentation, and I believe it's specifically at hospitals. So I think when someone goes to their primary care provider or they get an exam with a cardiologist or something, I don't think those locations are required. And I can confirm that for you if that's helpful. What we've done at UMC and just to let you all know, we've had, historically, we've never asked about country of origin or documentation status. That's been one of our policies. I think it probably goes into that acceptability domain. If we're creating an environment that scares someone or creates a context where they're afraid to get care, that's something we've never wanted to do. So we've never asked those questions. Once the governor had this requirement, my understanding is that we do it near the end of their visit. So we try to prevent the initiation of their care. And then we do it at the end of whether it's an emergency department visit or something else to try to mitigate any fears of accessing care. And I do not know exactly how our team is trained, although I believe we do make them aware that not answering is an option. I'm guessing that our legal counsels provided a lot of guidance on how making sure we do that appropriately. But I could get you better answers about, do we have a script or something that essentially lets every patient, regardless of their immigration status, know what their options are when that question is asked.
Thank you. That is helpful. Thank you. Does anybody?
Hi, John. It's Christina Paz here. It's nice to see you.
It's good to see you too.
Thank you. I think the other question we had with regarding access is affordability. As we start to look at women in general and the barriers that are often placed in front of them with access to healthcare, affordability can be one of those. Can you educate us on how UMC makes healthcare affordable for women, for example, who don't have any source of income?
So it's a little bit of a complicated answer. And again, there may be some technical points that you're going to tell me, hey, I really want to know technically, is this precisely the case? And I'll do follow-up and get you an answer. But from a broad point of view, I mean, first of all, if you come to our emergency department through a federal law called EMTALA, we will treat you. And in fact, all hospitals are required to treat you. What hospitals are required to do is to essentially triage and stabilize in an emergency department. That's the EMTALA requirement. I would venture that in most cases, we go further and make sure you get the treatment you need and you're not just triaged and stabilized. I mean, theoretically, a person could be stable at the moment and be discharged from an ED and the law has been followed. I think as an organization, there's always exceptions, but our effort is to make sure you get the treatment you need, even beyond stabilization. Beyond that, we have a program called Healthcare Options, which an individual applies for. You need to be a resident of El Paso County and within certain income parameters. And that program, it's not insurance, but it's a program that offers you certain types of services based upon your needs. So I think you can get a physical, you can get vaccines. There's a whole range of coverage is the wrong word, a whole range of services you can receive if you are part of Healthcare Options. Beyond that, if you're above those income parameters, we typically have some sliding scale models so that the patient can access different kinds of care that they want or need, I should say, that's tied to the income level. And then we do also have ways to serve people that don't live in El Paso County that also need to access care The healthcare options is really a response to the fact that we were set up by the state of Texas to provide instant care to the people of this county. And so that's why healthcare options is structured the way it is. But there are ways for people from other parts of West Texas or New Mexico to get the care they might need with us.
Thank you.
And John, when you say they must to use this healthcare options, they're residents, you mean you're using the term residents in terms of living residency, not in the immigration legal.
Exactly.
Okay.
Yeah, you have a domicile in El Paso County. That's what that means.
Any other questions of John?
That I can think of for now, Judge.
John, are they, is there any data collection on this, the governor's question, the issue of the governor's question about how many people are responding to that question?
Yes. In fact, we were required to produce a report, I think a week or a week and a half ago. I haven't actually seen the data myself, but if you're interested, I probably can get you those results. They had to be submitted to the governor's office. So I don't know what the response rate is and how many people are opting to say I prefer not to answer.
Uh-huh. And that report has to come in once a year? You're gonna have to do it every year?
No, I think it might be quarterly, but don't quote me on that.
Oh, quarterly, okay.
I know that, I think it was like the first week of March was our first required sharing of the data.
And as I recall, the reasons for that data was to be able to bill the federal government for that care?
I think that, I'm not sure the reasons. I don't want to, there's probably stated and unstated reasons. I think that one of the questions is there a cost to our healthcare system from being located on the border? I don't know what the intent would be to do with those data. It's a delicate issue because we do know there is a cost, and not that we don't want to provide care, but there's also questions as to when the federal government contributes to that cost, at least from a hospital standpoint. I don't think we're trying to use it as a political tool in our case. Just to give you some context, the Border Patrol will pick up someone who needs hospital care and bring that patient to us. Right. And then we provide care to that individual. And in those cases, there is some payment from the federal government. But it's a nuanced process that we've worked through over many years.
Thank you. Any other questions of John? Anybody?
No, thank you, Judge.
No?
I do. I have a question. Hi, sir. Melissa Hartcrow. Okay, I'm sorry. It's because I hear an echo. I keep getting lost on where the conversation is. So we talked about access to care. I would love to learn more in the future about perhaps more barriers. Like, for example, is there a barrier with transportation or childcare, for example? And then also, what are the programs, or I don't know exactly how to ask this, but it's regarding menopause. It seems like, from what I've been researching on my own, I'm not a medical professional, but there's not a lot of knowledge out there or extensive research for perimenopause or menopause or postmenopause. So I'm very interested in that and what is available through UMC.
And let me give you and actually, if I can just caveat one more time on everything, if you all want anything I've said and have it as precise as possible, if you could just let me know, and I'll make sure and follow up and give you an exact, 100% answer, because I'm firing off the cuff here a little bit, and I want to make sure I don't say anything inaccurate. We have our own OB-GYN providers, and that's probably the location where women are going to get the most care for anything related to menopause or that period in a woman's life. We obviously also have our own primary care providers, which are also dealing with, of course, the whole range of the scope of care. I do want to say that when we look at El Paso County, historically, a lot of our practices in our county tend to be like 10 physicians or less. There's not a lot of large groups. And you can, you probably know who you see for the doctor and how many doctors are in the practice. So from a UMC standpoint, the primary care footprint we have is pretty large. There's 5 different clinics across the county. And so the primary care or the OB-GYN care that a patient gets is probably the best answer to your question. I don't know that we do any explicit health education specific to, menopausal period in a woman's life. You raise a good question. Perhaps we should. How health education works and how people use it is a complicated subject because a lot of times you offer it and people don't necessarily use it. I think our primary and care footprint is probably the best answer to your question.
Thank you.
Are you familiar with our clinics at all?
Mom is a patient, but I'm not entirely familiar, no.
So we have a large clinic that is on the Gateway near Artcraft, which has 50 exam rooms, which is pretty busy most of the time. So it's a very large footprint. There's a exact duplicate of that clinic on Joe Battle on the east side. And then we have a clinic we've had over the years in Ysleta that's extremely busy, that is kind of near the Tiwa community in that area of Ysleta. We do have a clinic in Favens, which is, I think it's only one of 2 primary care locations in the vicinity of Favens. It's really a beautiful location and does a lot of great things. And then we have some clinical sites up in the Northeast, kind of near where Cohen Stadium used to be. And then with the bond that was passed last November, we'll be adding a clinic in Central, right near Reynolds and the Gateway, kind of near the UMC campus. And then we'll also be adding a clinic in Horizon. So we see the clinic footprint as really important for a whole range of primary care. And really the goal is for us to go from reactive care to proactive care. So the patient is getting the care they need in advance of, chronic disease and other conditions really developing further than they should.
Thank you.
Well, John, thank you so much. I think that's really sort of all the questions, and you've helped. Once again, thank you again for that very, that sort of definition that you gave on access was really, for me, very helpful. So thank you.
It's one of my favorites. So I'm glad you enjoyed it. I love that definition.
Yeah.
And it's actually, there's actually an article in the academic journal. The model actually is a little more complicated than what I said, so it's not just me making this up. This is a model that's used in academia and others to understand what access to healthcare is. And I just want to confirm, would it be helpful to get you more precise information about what's happening with the governor's order? And if so, I'll just confirm that everything I told you is exactly how it is, if that's helpful.
I think that would be helpful on behalf of the commission. Yes, I think that's okay. One of the areas now that we're concerned about. There's so many impediments already facing so many women in this community, and that sounds like it's one more. So it would be helpful to have that information because it helps us in planning and moving forward in ways to help maybe bridge those gaps or impediments.
Okay, let me just confirm everything I said. I'm guessing I'm 90% right, but that 10% may be important to you. And
your disclaimer is accepted. Yep, we get it.
And I commend your work, and if I can be a resource going forward, please don't hesitate. I'm very happy to provide whatever insights are helpful to you. But you also have have Christina there, so, you know, I'm just your B team, frankly. You already have the A team there in the room.
No. Been more than helpful. Thank you, John.
All right.
Thanks.
Thank
All
Have a
right.
good day.
Take care.
Bye-bye.
Thank you.
Bye.
So I hope that helped, maybe at least
That helped a lot.
help you all think, if you do have other goals aside from the summit that you're working on that you identified last year.
Mhm.
So if there is anything specific, we can discuss that now, or we could put a specific healthcare item on next month's agenda to discuss further based on the information today. Or now, if there is anything specifically you would like me, aside from what we've already discussed with Fix, if you would like me to go back to UMC, aside from the governor's orders, to request data from them, I'm sure they have data available.
I think it would be helpful to see what March looked like, that first quarter looked like, and then maybe wait a couple of quarters and then ask for another to see what the comparison is, how that, and then combine that with the Commissioner Harko's request to hear from Aaron about maybe having a little bit more definition. I don't know about definition. That's probably too much to ask of this administration, but maybe more revelation about the effects of some of these executive orders. You know, what 60 days down the road, how are things looking?
I agree with that, Judge, just because in the beginning it was the question and now it's the rates. And so what we're seeing at our community healthcare centers, all three of them are phone calls to our community healthcare centers about how else they can access healthcare without having to come into the clinic. So there's a fear now of now leaving the house, and what's that going to look like in the long term when it comes to our women and their health and access to health. So I don't know necessarily that we're going to get a really good picture over a short period of time. Like you said, it's going to be a long, as a result of these orders slowly coming out.
Yeah, but that historical context, if we know what we started at and where we,
The other priority that you'll have identified in your sheet, so you have public safety, security, and labor resources, which we're into. This was the health one, and then there was workforce and economic mobility. Any conversation direction for us at this time that you would like us to start working on? Any of those?
At this point, I think our focus really needs to be on the summit. Frankly, we'll be gathering some data bits, but I think in order to make sure that this summit comes off professionally, efficiently, it needs to be all hands on deck kind of effort.
Thank you so much for that direction, I appreciate it. Well, then with that will complete this. Unless there's anything else.
We need a motion to adjourn.
I'm sorry, no action for item 4D.
Yep.
4E?
D, we went back to D.
Oh, okay.
Okay. We can have a motion to adjourn the meeting.
The motion.
Second.
Commissioner Piscadero?
Aye.
Commissioner Pop? Aye. Commissioner Chavida?
Aye.
Commissioner Chu?
Aye.
And Commissioner Harko?
Aye.
Aye. Motion carries. This concludes today's meeting at 11:30 a.m.